Hey, so today's video is for people if you have ever experienced any pain in your jaw, TMJ issues, difficulty swallowing, headaches, sinus issues, literally anything in this general area. And truthfully, this can affect anything in your entire body because it is the fascia and it's connected through our whole body. But we're going to concentrate mostly on the jaw area today. So we are talking about the muscles that, like the masseter muscles right here, this big one, that's the first one I'm going to show. It will be affecting the masseter muscle, but also just all of the fascia throughout this general area. So it can reach up into your head. It can reach, like I said, anywhere into your body. But this one is really easy. You can do it just about anywhere. You might look pretty funny, but if you just have a second that you're sitting in your car and you feel tension in the area and you feel like maybe stressed after driving down the interstate or something like that, you can totally do that. But make sure you have a decent amount of time, because if you're like at a stoplight, that's not going to be enough time. But so make sure that you have enough time wherever you're doing this. This is great for throughout your workday, especially if you work at a desk job. This is a really good way to take a break every once in a while and just open up all of the tissues throughout your head, and this can affect your neck, all kinds of things. So first one, what you're going to do is gently cup your cheeks with your hands, and then you're going to very lightly kind of push upwards on that lower jawbone, but it's very, very gentle. What we're doing with this is just compressing the TMJ joint right in here. So temporomandibular joint. That's what we're doing, a very light compression. So obviously you shouldn't be talking when you're doing this like I am, because your muscles are not going to be able to relax. But if you're in a nice relaxed state, just pushing gently upwards, you're only going to hold that for about a minute. So we're not doing that as long as all of the other myofascial release holds. This is just to give that joint and the tissue some compression, because what it does is it kind of makes them feel safe, allows them to relax. But if it's painful, don't do this part. But for the most part, it should just kind of feel like nothing or feel kind of good. So then after you do that for about a minute, you're going to be in the same position. You're going to be cupping your cheeks kind of with your hands, and then you're going to lightly press inwards and then lightly pull downwards. So this is where you get the really funny face. So just this one is more of the prolonged hold. So you want to hold this for at least 3 to 5 minutes. And as you're doing this, you're going to feel relaxation through here. You'll feel it up into your head. Who knows? You might feel it elsewhere in your body. But again, just lightly pressing in and lightly pulling down and then holding. And then as things start to release, you'll notice that your jaw is opening more. You really want to make sure that's just relaxed so that it can just open. And you'll notice that it starts to melt and open more. So the next one is for the little muscles that are back in here. So these muscles can be really tender. So if you have jaw issues or if you clench a lot, these muscles can be really tender. So just be really gentle with yourself. This release is not meant to be forceful in any way. And if you are forceful with it, it will actually make it worse. Your body will tense up against it and you won't get the beneficial effects of the release. So what you're going to do is take both of your fingers. You can wear gloves if you want, or just have nicely washed hands. It is your own mouth, so do whatever feels good to you. And so you're going to take your fingers and put them inside, just on each side of your cheek. So you're not going under your teeth or anything. Your mouth, your teeth can be just gently resting against each other, if that's the position that your jaw likes to rest in. But you're going to take your fingers, stick them straight back, and you will feel there are some little muscles back there that are probably pretty tender or sore, and they might be really, really tight. So sometimes, I'm telling you, when I'm working on people, this muscle sometimes doesn't even feel like a muscle. It's so tight that sometimes it actually feels like it's as hard as bone. So don't be worried if you get back there and you're like, oh, that just feels like a bone. That's not what I'm trying to release. No, that probably is it, especially if it's tender. So my favorite way to do this is actually laying on my back, because you can use just gravity, and the weight will just gently allow your fingers to settle into those tissues. And so I'm going to show you that really quick. Okay, so now I'm laying on my back. And so you could put a pillow under your head, do whatever you want to do to feel comfortable while you're doing this, because you're going to be here for a few minutes. So what you're going to do is take those 2 fingers and you're just going to put them on the inside of your cheeks, but not in your teeth. So you can bite on your fingers, just on the inside of your cheeks. Let them go back, straight back towards the ground. And then again, if you're talking or anything, this is not going to be helpful because those muscles are going to be activated. But just try to just relax as much as you can. Close your eyes, maybe put on some nice music, because you're going to want to be here for about 3 to 5 minutes. So just straight back and then relax. And so that's it. So you'll feel your fingers, as that tension starts to release, you'll feel them just gradually settling back towards the ground, and you'll feel the tension of the muscles and the fascia underneath your fingers just nicely melting. So about 3 to 5 minutes there. Okay, and then the last one of this series that I'm going to give is for the tongue. So the tongue is attached to so many things. It's attached down through our throat, our neck. I mean, so much stuff. It affects digestion. There can be tightness, especially if you possibly had a tongue tie but were never diagnosed. Then this can be extremely helpful. If you did have a tongue tie and had it released, oftentimes this is very, very helpful in order to avoid or prevent that from tightening down again after you had a release. So again, this is just wonderful for so many things. This would be kind of my number one overall thing for people to do. Now, again, probably not one to do in public. It can look pretty odd. So what you're going to do is get a piece of gauze. So you can get the gauze that just comes in like the single packs that are just like the little, like I think that's 4x4 squares or something like that. And you can cut them or do whatever you want to. I just happen to have like big old rolls of gauze. So I just cut off a little piece. The reason for the gauze is so that you can actually get some traction on your tongue. If you do it just with your fingers, they're going to get slippery because of your saliva. So you want to be able to actually grab onto your tongue. So I'm going to turn so that you can see where I'm grabbing with this. So I'm just going to take my gauze and you're just going to grab the tip of your tongue and hold on to it and then just lightly pull out. You can pull in different directions, wherever you feel that tension. So the thing about myofascial release is just really listening to your body. Like, where do you feel the tension, and kind of go against that tense area. Now, don't like pull super hard, but kind of feel, oh yeah, I can feel it like down my throat. Maybe sit there for a little while, or maybe go over to the side if you feel tension just on one side more than the other. Totally up to you. But the main thing with this is, again, the prolonged hold, so that we're getting into the fascial system. So make sure that you're trying to do this for at least 3 to 5 minutes. If you can't do it that long, don't worry about it. Just try to do it as long as you can, because this can be kind of awkward. It's difficult to swallow. So try to get your swallowing done before you start. But just know, if you lose hold of your tongue, or if you need to swallow or anything like that, just do it and then reset and start your release again. So I'm just going to show you really quick. So I'm going to put this around the tip of my tongue and then haul. So that's literally it. All you got to do is pull, and like I said, you can move in different directions, up, down, side to side, straight out, whatever feels the best for you, and just hold for those 3 to 5 minutes. So I hope that this was helpful. Just great things for all, like I said, all things in the head, neck area especially. And let me know if you have any questions. Like this video, subscribe to my channel if you would like to see more content like this. Have a great day.